So maybe it is ileosis early or something.
This is, what? Hepatic steatosis. No, Dr. Scholz, I've seen a million. But you haven't seen this.
I have not seen that.
This is called focal hepatic steatosis. Other people call it tumoral steatosis.
Okay.
This is from the literature. And again, it looks like tiger spots.
Okay.
Focal steatosis. It can be, as we know, random around the gallbladder fossa with sparing. Falciform phenomenon, you know about that.
Yeah.
Subcapsular, always change level in windows, and you'll see the capsule, it can be spared. And it can be lobar, sublobar, wedge-shaped. And then there's, I call it the spotted Dalmatian, or the leopard spots, the tumoral. And then there's another form, perivascular. And they all have etiologies, and the focal or tumoral Apache hemochromatosis was that last patient, and then chemotherapy. For some reason, it creates these little rings of fat, mimicking malignancy. Oops, back we go. Was it worth getting up this morning?
Absolutely. So these are going to be on my boards, is what you're telling me?
I don't care about the boards. Everyone here is going to pass the boards. Certified. Certified. I care about life. That's the boards. That's really the boards.
Fair enough.
And this is a case that some people would say as they're reading, I'll never see it. But I've seen 2 cases recently. The once in a lifetime cases, when you get to be 20 and 30, you'll see your 2nd, 3rd, and 4th ones. So you put them in your differential and expand it. So,
Dr. Scholz, was that a tumoral or a perivascular one?
this is tumoral.
Okay.
Perivascular fatty infiltration. All right, a good question. Here's a literature example, 2015, and this one goes out around the perivascular hepatic vein. Look at that. Is this not cool?
It's pretty cool.
Right? So, you're better than the boards, remember that. You're better than the boards. You'll come out mad at the boards. I studied my buns off, and they didn't ask me too much difficult material. So these are all examples from the literature on the perivascular form. And you notice it can be asymmetric, lobar. There's a lot of things we do not yet understand, and that's for your generation to work out.
So if we had that first tumoral case,
yeah,
you would recommend a liver MRI, right? You wouldn't just call it on CT.
If you see Aunt Minnie, you don't send it to the gynecologist.
Well, like the original, with like the history of lymphoma.
Huge. You treat her nice. You know what it is, and you're a differential. Instead of a long list, you be as precise as possible. Otherwise, you send people out goose chasing. You look at the history, and if it has those perfect leopard spots with blood vessels perhaps running through, you know what it is. There's nothing else that will look like that. And the rims, you notice, remember, they were all perfectly thin. They were all uniform. It was all sort of a metabolic process rather than a random neoplastic process where all the cells are growing at their own rate. You know, autonomous republics of evil. So that's that. Enough already.
The MRI.